Okay, good morning, everybody. We'll get started in just a minute. Let those last folks take a seat, please. Excellent. So today we are going to be hearing a fireside chat, which is a panel of individuals who are emerging professionals in the field of nursing informatics, including researchers and clinical informatics experts. Before we get going, I have some housekeeping messages to go through. First of all, it's okay to take some photos, but please do not film the events. We do not have permission from everybody who's attending the event to give us filming permission. So we ask that you not film the events. The events in this room, Lecture Hall B, are being filmed by our media team and will be stored on a YouTube channel that will be privately accessed by people who've signed up for live streaming access to the conference. And so just please don't video record any of the sessions, please. All right. I also want to inform, first of all, there are no fire alarms planned for today. So if you do hear a fire alarm, please please leave through the marked exits in an orderly fashion and gather outside at the muster point on the green. And so that's the green space that's kind of kitty corner from the entrance to the building here. That's my public service announcement. Now I'll do some IMIA service announcements. I'd like to inform those who might be interested in the IMIA-NI advisory panels. There are 4 panels, one on research, one on education, one on governance, and one on practice. These are aligned with IMIA-NI strategic goals of advocacy, collaboration, membership, academic, and professional excellence. The role of the advisory panel is to collect people's thoughts to advise IMIA leadership on how it can better support nursing informatics in these 4 areas. Please join us today from 12:45 to 1:45 if you are interested in being part of these panels. We have been sending out requests for people's participation through the IMIA newsletters. We recognize that some of those aren't fully disseminated, so we're inviting you here today just to hear about how you can participate in these groups. And before we introduce the panel, I would like to acknowledge the 2024 IMIA-NI Leadership Award recipient, Diane Skiba. Join me in congratulating Diane. This award is presented every 4 years to the person who has demonstrated persistent leadership excellence and contribution to IMIA-NI. The award was presented last night at the IMIA-NI board event, and we're just so grateful to have had you be leading us for all these years, and you're so well recognized by this award. Again, join me in congratulating Dr. Skiba. Woohoo! And Diane is down here in the front row. Please come up and congratulate her after the panel happens. Thank you so much. I would now like to introduce the chair for this session. Let's see. If you could go back to the holding slide with the fireside chat on it. Thanks, team, our excellent media team here today. So I'd like now to introduce the session for the chair. For this session is Dr. Max Topaz, as well as our panel guests. Max is the Elizabeth Standish Gill Associate Professor of Nursing at the Columbia University. He is a pioneer in applying natural language processing and solutions to advance clinical decision making. He's a previous chair of the Emerging Professionals Working Group of IMEA. And so thank you, Max. Oh, we forgot your chair on the podium, my bad. On our panel, we have Ryan Chan, who is a recently appointed assistant professor at the Arthur Labatt Family School of Nursing, Western University in Ottawa, Canada. He's continuing to complete his PhD, and his doctoral studies are exploring the influence of artificial intelligence-enabled machine learning decision support systems on clinical decision making. Next, we have Ana Solano Lopez, who is an associate professor at the University of Costa Rica. She is one of the first generation of nursing PhDs from Costa Rica. Our third panelist is Claire Ford, who is a lecturer in the Division of Nursing, Midwifery, and Social Work here at the University of Manchester. Claire's PhD studies, recently minted, developed and evaluated a virtual reality-based program for falls prevention in care homes. And our fourth panelist is Wei Ping Li, who is an experienced clinical nurse currently holding positions at both the Tri-Service General Hospital in Taipei, Taiwan, and the Republic of China Air Force's Medical Group. During his master's program, he specialized in AI-related algorithms, enhancing the efficacy and comprehensiveness of nursing handover processes at his hospital. His ongoing work focuses on integrating AI to further improve nursing quality care. I now hand over to Max for the rest of the session. Thank you.
Thank you, Lynn. All right, good morning. Thank you so much for making it here to this important session about students and emerging professionals. This group is very close to my heart, and we are going to hear participants talk about their journeys today. We're also going to have time to ask questions in the end of it, and we have a series of questions that will lead them through their journey up to this point. So that's kind of the introduction that we got today. And it's a fireside chat. We don't have a fire, so it's a morning side chat or cereal chat, coffee chat, whatever you call it. So let's go. All right. And we'll start with the first set of questions. So the questions are going to be to all the panelists, right? I'll pass the microphone. You guys are going to be able to answer those questions. And so let's start with the first question. How did you end up at the place you are now, and kind of what brings you here? All right, Ryan.
Thank you. Good morning, everyone. As Leah mentioned, my name is Ryan from Canada. My journey to here began on Saturday from Toronto Pearson Airport, and now I'm here. Is that good? So my journey to nursing informatics is actually, for me personally, an interesting one, and one that I still find myself not necessarily believing in, because certainly heading into nursing, informatics was certainly not an area that I had my eye on, or not necessarily something that I would see myself doing. And through one of the core courses, which was on a morning in a weekday, I didn't necessarily see myself, but over time in my practice, certainly in my graduate years in the undergrad program, as well as into my grad school, I definitely found that a lot of our nursing work and the work that we do, either it's at the clinical setting at the bedside or at a policy level or at leadership level, many of them did have implications related to informatics. And so through that, I continue with my grad studies, currently working on my PhD, and so it really has helped brought me here today. So, and meeting amazing people here, so yeah. Yeah.
All right.
Thank you. My name is Ana. I am from Costa Rica. So I will tell you a little bit about my story. As you mentioned, I am part of the first generation of doctoral prepared nurses in Costa Rica. So that alone, it's a challenge, but it's amazing too. Thank you. And my journey in nursing informatics started when I started the doctoral program at Case Western Reserve University, where I graduated in the United States. So when I arrived, I started to see how they measure objective, variables with devices, wearables. They were making avatars to measure or to help patients with decision-making processes using advanced statistical programs that I never saw in Costa Rica. So that was my first approach, and especially because it was so innovative for me, because if you think about a girl without a computer, without a cell phone, and just doing homework on internet cafes in Costa Rica, to go to the United States at that time and see all those things, for me was like amazing, right? So I started to learn about this and always think about bringing that knowledge to my country, and that is what I'm doing right now, basically. That's my journey.
Good morning. My start, I suppose, in nursing informatics was as an undergraduate doing my nursing degree here in Manchester. I was really interested in research and looking at opportunities where healthcare professionals can utilize data to support their clinical decision making or improve quality of communication with patients, whether that's through remote monitoring, using apps and things like that. And essentially I got talent spotted by some of the team in our division, and they said, oh, do you want to do an internship? So I managed to conduct a little tiny little research project in my first year during the summer, and it really sparked that fire of really kind of pursuing this further. And I suppose it was just more of that kind of passion that continued throughout my undergraduate degree, and I did my dissertation to do with how healthcare professionals can utilize mHealth data in the self-management of long-term conditions for older people. Which did really well. It's probably very outdated now. It's very commonly used, but at the time it was really, really uncommon. And it was something that my dissertation supervisor was really impressed by. I got like stupid high marks, and they went, you'd be a great PhD candidate. And it was something that I never thought I'd ever do. It was never my line. I had a job lined up. I was going to go work in surgery at Manchester Royal. It was never my plan to go into an academic career, but I'm just so kind of impressed that there was a really supportive team who saw something in me that I didn't see in myself to then get me where I am today now.
Good morning, everyone. I'm Wei Ping Li. I'm from Taiwan, and my interest of nursing informatics is from when I studied college at 2014, and I'm studying in the military university. So there also have engineers with my classmates. So that's why I want to combine maybe technology with healthcare. And after graduate, I work in military university, and I also work in Air Force Base and to transport the patients around our country. So in the beginning, we all are the paperworks. So I want to find some AI tools to carrying the patients between transport them, and this is my journey of the nursing informatics. Thank you.
All right. Thank you for sharing your journey and how what inspired you to do what you're doing right now. So let's talk a little about things that made this journey successful for you. So like what are some of the keys for success? For me personally, it was my fellow PhD student. When I started my PhD program, I wasn't focused on informatics specifically, but then there was another student, and she was always talking about technology. And I didn't get it. I said, oh, wow, what's this technology thing? And that's how, I started learning about that, and I ended up doing that. And what was this for you? What were some of the key things for success that you've seen so far? All right, Ryan? Okay.
I think for me, because I had the chance to be involved in nursing informatics in such an earlier point in my academic career, I would say as a student, one of the things that was most helpful for me is definitely mentorship, having some really amazing mentors, many of them in this room. And I think that has really helped me because for me, starting in a new field is very, very, although exciting, it can be very, very nervous at the same time. And I think being welcomed into a community of nursing informaticians, and of course, as nursing informaticians, I've come to learn we really have a lot of fun. So that's something that I would say has helped me. And certainly, I think my graduate student friends, who we all try to write or do our work together. So I think that has been really helpful for me. So.
Thank you. I will answer this question in two ways. The first is about research, and I think the key ingredient here is, like you mentioned, the support of experts in the field, because we are emerging professionals, so we need that mentoring process. So for example, for us in the University of Costa Rica, we now have a Center for Research. And the first formal training session we had was with some Norwegian nurses who are here in the audience today. So I think that speaks a lot of our interest as a country to be speaking about e-health, for example, and nursing informatics. So, and also I have been looking for other opportunities to engage myself in to get more knowledge. So for example, I won a spot in the Global mHealth Research training in NIH at the United States, or I collaborated in some other paper with people that are here in the audience too about how to manage digital health. So that have bring us a lot of visibility and knowledge. Also, I will say another key element for me has been persistence, especially in a place that don't have a lot of resources in terms of economical resources and technological resources. So for example, for my own research, sometimes I have to persist in the thought of not sacrificing science just because we don't have the tools. So I have to be persistent to go and find other ways to finance it and convince people, but not sacrificing, a variable just because it's measured in a more technological way and things like that. So it has been a challenge, but I think the persistence through this process is important.
I think kind of similarly to what the other speakers have said, I think having a supportive team and mentorship is a big supporter and driver. To know that you've got people supporting you and helping you with grant applications and supporting kind of your research endeavors, and kind of when there's peaks and troughs in motivation in your projects, there's always someone who's always rooting for you. I think that's always really beneficial. And I think another thing is, another kind of motivator to success is seeing translational research actually being implemented in practice and seeing the actual tangible difference that you're making to people, whether that's improving, well, sort of in my research is to do with quality of education being delivered. So seeing people really wanting something, and then you test it out and they really like it, and then that really kind of drives you forward to kind of keep pursuing it and knowing that what you're doing is really making an impact. I think that's kind of been my route to success, essentially kind of buy-in from healthcare professionals. I mean, it's been talked about a lot over the last couple of days that you need to have nurses involved in the decision making and the design and co-design of technologies, because they're the ones facilitating it or adopting it, or supporting people using it. So again, it's kind of having that motivation and passion from healthcare professionals as well as a real kind of incentive to success for me.
And for me, I think that's two key points. And first, and it is a good passion to do for it, and because we are busy on clinical working, and so we need to spend more time on nursing informatics research after work, and we need to spend more time and find our we have the same interests, nursing together to working together or do the research together. So if you don't have a good passion for it, you maybe fail. And second is maybe have well communication with the medical group, include the IT stuff. And in our hospital, IT stuff maybe have maybe 30 to 40 stuff. And sometimes in clinical language is they cannot understand of us. So it's very important the role of the nurse informatics. And we can translate something they can know what we actually want. And it will be play a good role at the maybe in caring patients or the IT team, IT names will be good to work with in clinical. Yeah, thank you.
All right, awesome. What interesting stories you have. Really, some of the key elements that came up in those are, I can hear those reflected in other stories as well. So I think it will resonate with the audience. You talked about some of your journey. You talked about key strengths. What are some of the key things that made it possible. Now, each one of our journeys is we face some obstacles and some hard things that we need to overcome and do. So let's talk a little bit about that. What are some of the challenges that you faced on the way to get here? And it's not easy to be an emergent professional from your early PhD courses or early coursework of any type, right, to transitions between countries and within countries, from place to place. What are some of those challenges that you would say that are kind of some of the key challenges?
I think personally for me, in my journey so far, there were a few challenges or opportunities for further growth. One of the main opportunities, I think, for me personally, having perhaps it is within my own experience in formal undergraduate nursing education, is that informatics isn't necessarily a dedicated topic at the time when I was completing my undergrad. And so the knowledge and skills I learned, I had to sort of learn it from outside of the classroom. And that includes, from fundamentals of informatics to maybe statistical learning. And so all of those, I had to find that it was sort of outside, above and beyond, and I had to spend some extra time in learning that. The other thing is the time it took just a little bit longer, I would say in my experience, to find like-minded people. Again, I think at the time it was harder to find nursing informaticians as an undergrad student or somebody I could talk to and learn from. So those were, I would say, some of the key challenges I had at the beginning. But I think over time, I perhaps tried to overcome some of those challenges. But certainly I think, some of the challenges hearing from this conference, learning that they're not necessarily unique to me. So it was, in a way, also confirmed for me that, I wasn't necessarily as bad as I was. So, yeah.
So for me, I think I mentioned already, it will be the lack of resources, and that reflects on the lack of accessibility, to this type of data and technology, and also the poor technological infrastructure that we have right now in our institutions, in the healthcare system, and also in the academia. And also, we do have an incipient medical electronic record, so we don't measure data as well as we want, even though we do have a strong healthcare system that is social, public, and we do have good results, but we don't have a lot of data that measures that. And if we think about it, we don't have nursing data, to try to justify why do we have these kind of good measures in terms of health in my country and within the region. And also the lack of education and formal training, let's say, in these kind of topics. The people who are interested in this topic in Costa Rica, they self-taught themselves about it, so we don't have a lot of content or courses within our curriculum. So right now I am coordinating a management course for nurses in the undergrad. So we started to put contents in there about e-health, tele-nursing, data management, and also this year we will have our 4th hackathon, for example, that we brought up to Costa Rica for the first time. So these kind of things will help, with this challenge that we have. Also, I think that I can feel nurses having fear about this, about technology, data, numbers, things like that. So that's another thing. And yeah, I think those are my ideas. Thank you.
I had the pleasure of doing my PhD during the pandemic, which is obviously, I'm sorry to mention it, everyone's getting trauma from it, but it meant that my research was, I felt like I was completely on my own, and it felt like I was just a little silo doing my own research. I then did my postdoc, and again, I was completely on my own doing my research with my PI, and I think that time, I wish that I'd had more opportunities to do more collaborative work, and I think that was probably one of the real barriers for me. But that's starting to change now. I'm doing a lot more collaborative work with people, and I'm wanting to do more. But that's definitely kind of the big thing for me, and I think the pandemic was one of the reasons why it was a challenge, that I was focusing on my project, and at the time, no one else was doing VR in our division. That's changed now, but at the beginning, it was just me, and so I felt like I had no one to talk to or come up with other projects within this space. That, again, that's changing. We're putting in other grants and things. That was a big problem. I think another barrier is, I'm trying to find a way to describe it. It's kind of what Anna was talking about, where sometimes it's getting buy-in from healthcare professionals. When I graduated my undergraduate degree, and they said, "Oh, what job have you got? Where are you working?" And I said, "Oh, I'm doing a PhD." And they're thinking, "Well, what are you doing that for? Nurses don't do research." And again, when I went to go work in A&E, they were going, "Oh, where have you come from?" And I said, "I've come from the University of Manchester. I'm doing my PhD." And again, they'd say, "Well, what are you doing that for? You should be doing direct patient contact, Don't be in an office, don't work in technology, don't collaborate with industry and things." So I think it's changing, but I think there is still a bit of resistance to kind of nurse academics, and obviously everyone here is very for it, but I think sometimes there is a bit of a resistance to change sometimes in clinical practice.
Thank you. And I think the main issue or challenge I'm facing, maybe have 3. First of one is when the system maybe giving change from the past one to the new one. And sometimes if we want to do some research or big data, the data will be, it's better be structured and will be better to analyze. And you need to persuade the IT stuff to do that things because it's very hard for them. And the second is also she had mentioned is education about the stuff in the hospital, because someone have interested of nursing informatics, but they don't have resources to learn about it. And so in our hospital, we have some lectures or some conference to communicate with others, medical school or some hospital together, and that can give some resource for them, and we can know who are interested, and we can work and do the research together, and with more people to improve the project. Okay.
Oh yeah, that's just amazing how those challenges, I think, resonate. So, listening to you, I was remembering some of my personal challenges and some of the things that I've heard over the years from people, starting from the pioneers in nursing informatics to all the way to us, and to you guys, right? So some of the challenges persist. And Claire, thank you for reminding me of one of the challenges I had. When people would ask me, right, early on in my PhD, what do you do? I would say, and English is my 3rd language. So I would say, I'm doing a PhD in nursing. And they will be like, neuroscience? no, nursing. And they're looking at me, right, as well, putting things in the context, like, what, you do PhD in nursing? That's, it's ladies that work in the hospital, so, some of that I can relate to, right? They really had a hard time positioning myself and doing, something with that, or, what people do with this thing, right? Also, all of those questions came up. So it's amazing to see how, transferable those things are. All right. So let's transition a bit and talk a little bit about what are some of the things. So this organization and EMEA as an organization in general, we spend a bunch of time thinking about engaging students and emerging professionals into the organization, right, and at large, and then into separate communities, right, that we have around the organization. So we have a students and emerging professional group that we co-organized some 10 years ago plus, and this group is alive and kicking. So that's kind of one way that we were able to address some of the issues that we faced, right, and you were describing. So what are some of the ways that you would think about how this organization, other organizations, can support students and emerging professionals? So what are some of the key things that people can do, right, to help?
Anybody want to start first?
Maybe this way.
Oh, really?
Thank you for being brave,
Okay,
suggested.
thank you. So nervous. I think the support from the young nurses is we need to foster a culture of continuous learning and innovation, and providing access to maybe specialized training and education in informatics in essential. Okay. And maybe in hospital, we need to have a group to support them. And because in our hospital is our university just near the hospital, so sometimes we have some cooperation together and let the students join us in the clinical research, and it will be early for them to involve the nursing informatics, and when they graduate, and they will be patient on it, and we can also maybe work together and will make the nursing informatics of our hospital be stronger. Okay.
I think it's visibility and knowing that we are here and we are proud. So that way people can actually see, whether from a student nurse perspective, that these careers do exist and you can live in this space. I'm really happy that I get to work one day a week with the Digital Nursing Midwifery Allied Health Professional team at Manchester Foundation Trust, and they do an awful lot about digital transformation, particularly with the electronic patient record. And I helped a lot of that team supporting them when they had their conference, the sort of Manchester Foundation Trust MMAP conference, and the theme was digital. So obviously the digital team had a big presence there. And again, that improved their visibility, and so people could reach out to them and get in touch and go, we've got problems in X, Y, and Z. So it's helping finding solutions, as well as supporting that team with coming up with research projects and service improvement projects across the trust. So it's that visibility, I suppose, whether it's to student nurses, kind of corporate digital teams, and nurses at the bedside.
So I have a very specific idea for this organization, so I will throw throw that idea there. Like we have been mentioning, we need mentoring and education. So if you don't invite me here, maybe I could not be here because of the resources. So I know in another organization that it's not about informatics, they kind of have a, let's say, a scholarship for these kind of events where people from, for example, developing countries can participate. And if they win, they are not only given the opportunity to be in these kind of events, but also they paired us up with mentors for a year, for example. So that way you can broaden the help or, the support for others in countries that don't have the resources that some of the developing countries have. So I think that's a very practical idea that you may think of. And also in terms of research, also people from developing countries can collaborate with us in multi-site projects or replication studies. And if the organizations have the possibility to offer grants, I do think that sometimes grants have to be more tailored in terms of what kind of milestone they expect for people, because some people that have the money, if they just throw a grant out there for everyone, then we may not be able to compete, with some other countries that have the resources to, have high impact publications or preliminary data with a lot of, objective measures and things like that. So I think that's something that we need to be focused on, because other sides of the world needs to be developing this, but because of the lack of resources, we cannot, even though we do have the capabilities, the abilities, and the knowledge. So I will throw that idea there.
For me, I think an idea that I have, and I think certainly I would have benefited as well myself, is anytime I sort of reflecting on my earlier times looking at, joining different associations, different groups, the first thought is it's very intimidating as somebody with perhaps little to no background, and sometimes to see big names on lists. So one of the ideas I had, and I'm hoping to implement in perhaps some of the groups I'm currently with, is something like an ambassador program where, students or anybody who is, opening to joining for the first time can simply write, maybe it's a certain individual or small groups, to really say, I have no idea, but I want to be involved, and slowly starting from there. Sort of a point of entry that's, not necessarily too formal. So I think hopefully that will help. It certainly would have helped me, but a lot of my mentors did help to bring me into some of the groups, so that's something I benefit from. So.
All right, thank you so much. It's some strategies that we will make note for sure. All right, I'll open it up for audience questions. Let's see. So we have a few minutes for that. Feel free to ask questions. All right, we have a first person.
Hello. I noticed that I think all of you or most of you have got a PhD or are doing a PhD. Do you think that for someone who is emerging in nursing informatics that they have to have a PhD? Might be a slightly controversial question, and I should preface this by saying I'm currently doing a PhD myself. But do you think it's necessary though? Because I think there's a lot of pressure on people to go down that path, and sometimes I'm just interested in your thoughts as to whether you think it's necessary.
So I'll turn it over to people who have their PhDs.
That's true. You're almost there.
No, you're almost there. You're eligible to answer to.
In terms of my experience and what I have seen in Costa Rica, right now the Committee for Nursing Informatics in Costa Rica, it's composed of 5 people. And none of those people have PhDs. One is from the public healthcare system. Another one, she is in a private institution. And another one working, with occupational health, things like that. So I think what they have in common is the passion that they have for this topic, and also that they are willing to learn more. And I think that, at least for this specific group, that is the one that is working most in Costa Rica, is because they want to see a change in practice. So I think if you don't have a PhD, you still have that So it doesn't matter. It's good to pair up with people who have that kind of knowledge, because then may add the science piece and more knowledge about data. Maybe they can go further, but I think it's all about the team, to have different capabilities within the team so we can advance.
Yeah, I completely agree. I don't think you need to have a PhD to pursue a career in informatics. I think a PhD is a demonstration of grit, I think, and kind of stubbornness to get through a project for years and years and years. But obviously I enjoyed it, but it's it's kind of a bit of a ebbs and flows, isn't it, of motivation. I think, like Anna said, I think it's the team, and everyone's got a different skill set. And I think if you've got a PhD, it's a demonstration of that you can conduct research independently. So you've got those skills and research method skills and data collection and analysis skills, but they can be used to support somebody in clinical practice that's interested in pursuing research, just to give them kind of assistance and guidance. But I don't think it's something that you necessarily have to have as a requirement to kind of have a good kind of flourishing career in informatics, because it's like Anna said, it's the passion and it's what you want to see change in practice. So if that's going to take years and years and years out of clinical practice to go do a PhD, then it's probably better if you stay in practice.
I'm still studying PhD now, and I think maybe it's not necessary, but we can get many benefits from them. The most, I think, is you can get some resources from government, and you can work some research or project with government, and you will get some money. The resources will more than you studying that at the school. And second is because we have many groups in schools, so you can get some resources to have the supported together, and maybe you will meet some group, some research group, and work together, and will make your project more complicated, more complete. Okay, thank you.
I can add a comment. I think for me, it reminded me of a conversation I was listening to talking about masters prepared for informaticians. And one of the things I took away from the conversation was sometimes the credentialing could certainly involve many of the things, experience in research, demonstration of specific skills. The one thing I came to learn through my PhD is also the knowledge and skills that perhaps even baccalaureate prepared nurses may have. So it really, for me, it depends on the specific field you're in. If you're in clinical practice, often your role and the work that you do may not necessarily lend itself to a PhD. So I think personally, I wouldn't say at all it's requisite for things. However, depending on the subsequent roles. So for example, in academia, perhaps it is more preferred compared to other areas. But I think certainly one of the key things is the knowledge and skills, and often it's hard to necessarily put a defined credential on it.
All right, thank you so much. I have time for some more questions. Let's see. All right, here's Judy Murphy. You have a question? We wondered if you would have a question.
Thank you for those comments. This is a topic, the education comment, that's near and dear to my heart. I entered practice in the 80s, so there were no programs, and definitely no PhD programs in informatics. So it's interesting to think back over the years and how we learn what we learn. But standing here today, one of the things that I'm struck by is, we hopefully have research-based practice, but we're really migrating toward practice-based research. Now with an electronic health record, we don't have to use the traditional methodologies that we've used over the last 20 years to do research to understand nursing's impact on practice, right? Because we have a lot of data that we can mine right out of our electronic health records. So I'm interested in your comments related to practice-based research, and how you can involve the professionals that work in the hospitals, master's prepared, bachelor's prepared, or, continuous quality improvement and research are sort of merging in my mind. It's not like we do research and then we live our lives and then we do research and we live, right? It's all integrated. So I was just interested in some of your thoughts on that, having recently come out of school or soon coming out of school with your PhDs. I know that was a long question, but.
No, I think while I was doing my working actively during the data collection of my PhD, I think one of the things that, Judy, as you mentioned, the practice piece is very, very important. And I think when it comes to education, it certainly allowed me an opportunity to take more of an active role in healthcare research in general. Certainly, I think there's a lot of sentiments in clinical practice that a lot of the research is perhaps driven by physicians at the time. And certainly, great research, and I think we work well within teams. However, I think for my colleagues who are seeing me doing research and having the opportunity to do that, it re-emphasized the importance of their work and how it plays in the bigger system and in the bigger research, because we as nurses, we do spend a lot of time, if not the most time, with our patients, and I think that constitutes a big part of practice. And so for me, doing my PhD, interviewing nurses, and often the first question that I get is not necessarily about the research, is why are you doing this? And I think many of the panelists spoke to it. So actually I spend a majority of my time letting them know sort of why I'm doing this, the importance of the work. Then we get into the research questions. And so for me, the practice-based piece is very important, because one of the earlier goals that I wanted to personally do is to allow my colleagues who are nurses to perhaps have a contribution, a formal contribution in the literature in the area that I'm looking at. So in education really gave me that opportunity, and I hope, as more and more nurses, conduct research, whether it's in a formal capacity through education or even in quality improvement initiatives, that more and more that becomes evident, and hoping to potentially, allowing that practice-based evidence to emerge. And certainly informatics is a great help in analyzing all the data, but certainly, again, involving nurses would be key. So.
In my case, because my context is different, I think we need to improve our data, our systems to collect the data. Because maybe you are thinking about this because you already have some instruments to catch that data. But in countries that don't have that, I think that we need to empower nurses to be able to see the value in collecting that data, and also to be able to participate in the creation of these systems that are collecting the data. And also I noticed that sometimes nurses back home don't have that curiosity. They just do because they have this overload of work. So that is another skill that I think in my context, it's needed to be able to spot the places where research can be done out of practice.
I've just seen Leanne's got like a 2-minute warning, so I'll keep it really short and sweet. I'm just going to signpost to Justina Smith because she's got a poster today. She's a digital matron from the digital MMAP team at MFT. You're talking about practice-based research. They do an awful lot with the electronic health record, and they do walk-arounds on the wards, and they go talk to staff, identify problems, and then do service improvement and auditing based on that. And they utilize like efficacy data, all sorts of stuff, and how kind of snags and problems with the electronic health record, and finding ways to refine it and perfect it to improve the way that healthcare professionals, particularly nurses and midwives, use the electronic health record to improve efficacy so they can spend more time doing patient contact. So it exists. Talk to Justina.
So it's an and, not an or. Yeah.
Yes, yeah, absolutely. Is that time? Sorry.
Thank you so much for this. And yeah, we're being kicked out. Thank you so much for this. That's an awesome conversation. And, happy to see. So if there are other emerging professionals, please find us, please find those folks. And I wanted to point to two people there that are currently chairs of the Students and Emerging Professionals group. So Molly and Jiyung, if you can stand up, people can come to you. Then and finally, stand up, please, stand up, so people can see you. All right, if you have more questions about emerging professionals and things like that, please do come to them.
Great. Thank you so much. And thank you so much, Max, for facilitating this great conversation. I actually was taking a lot of notes, so I'll make sure they get to the EMEA board. I have a couple of announcements. First of all, those of you who are coming to the social event tonight at Band on the Wall, there will be an email going out with directions, and we will. The food will be started at 6:30. People can start arriving at 6 o'clock, and you'll have the. It's about a 40-minute walk from here, but you might want to take a taxi if you're coming. And secondly, I want to just say thank you, everybody, and a warm round of applause for our whole panel and for Max. Please join us downstairs for coffee break and the poster session today, where we have another 56 excellent, amazing posters. Come and see our amazing work that is being presented at the poster session. Thank you.